Okay.
Hi, my name is Billy Partita. Doctor has ordered for this patient morphine. She's having some pain, so we're going to give her morphine today. Going to knock on the door, provide privacy. We need to check her chart for any allergies to the medication. And I have checked it. She's allergic to hydromorphone. We're going to be giving morphine today, so we're okay. I'm going to wash my hands. Hi Debbie, my name is Billy Partita and I'm your student nurse. The doctor stated you're having some pain today. We're going to be giving you some morphine. Can you verify your name and date of birth? And she says Debbie Michaels, 5/18/2006. And I did notice you're allergic to hydromorphone, but we're giving you morphine, so you will be okay. I noticed you don't have any IV solutions running, but if you did, we would stop your medications for the IV fluid for 2 minutes while we give you this medication. I checked your site. It looks intact. I don't see any infection, infiltration, phlebitis, no redness or swelling, so we are good there. Do you have any questions at this time?
No.
Can you rate your pain for me?
9.
Okay, so after we give this medication, you should feel better. I do want you to use the call light if you need to go to the bathroom, as this medication can cause nausea and drowsiness. We just don't want you to fall. Okay?
Okay.
All right, so first we're going to be, I'm going to wash my hands. And I will put on my gloves. So the reason people have a central line a lot of times is because they are either on dialysis or they have long-term antibiotics that they need. So the doctor will put in a central line for them. So I'm going to put on my gloves. First, you want to verify your medication that you have and the rights for the patient. So I have morphine sulfate, 3 milligrams per 2 mLs, and I have Debbie Michaels, date of birth 5/18/2006. Orders show morphine 2 milligram IV push every 1 hour, PRN for pain. So I have more Debbie Michaels, 5/18/2006. Morphine 2 milligram IV push every hour for pain, and I have morphine sulfate 3 milligrams per 2 milliliters. So first we need to draw up the correct dosage of medication for the patient. So I need to weigh some of this to get the right dosage. Okay, so we need 1.3, I did the math, it's 1.3 milliliters. I'm gonna waste. Alright, so you want to make sure you got all your bubbles out of here, and then you verify that the expiration dates were current on all the medication and the saline flushes. Okay, so I have 1.3 ml. Of the morphine sulfate for the patient. Okay, now we need to verify again. I have the 1.3 ml for Debbie Michaels morphine sulfate, 5/18/2006. Orders show morphine 2 milligram IV push every 1 hour for pain. I have 1.3 milliliters. As I did my math for Debbie Michaels, 5/18/2006, morphine 2 milligrams IV push every 1 hour, PRN for pain. I have Debbie Michaels, 5/18/2006, morphine sulfate 3 milligram per 2 ml. Order shows morphine 2 milligram IV push every 1 hour, PRN for pain. Did the math, it's 1.3 milliliters to give the patient. Now the book shows that we need to dilute the medication for the patient, so I'm going to waste some of the 10 ml to have room for the medication. You waste and then you pull back. So I'm going to insert the medication into the flush. The Betty book says that this medication is compatible and that it needs to be given over 4 to 5 minutes. Once you put the medication into the flush, you want to get out the air bubbles. Okay, no air bubbles. You want to label your medication so that this, you know, this is your medication you're going to give. Put names, patient's name, date of birth, and the medication. And the dose, which is 1.3 milliliters. Label your medication and set it aside so you know that's the medication that you're going to give. Here's the other 2 flushes that I have. I'm first going to clean off for 15 to 20 seconds or per protocol at your facility. You want to unclamp the lumen. First, you're going to flush 10 milliliters of the saline solution into the central line. This is to make sure that the line is patent and is going through good. Alright. Then you will insert your medication. While doing your medication, as we said in the Betty book, it's 4 to 5 minutes. You need to watch that on your clock. If it's a child or an adult, you want to go slower. Watch for any adverse effects, allergic reaction, any CNS reaction for the patient while giving the medication. So now we're going to give this medication over 4 to 5 minutes, as I had stated. Taking your time, going slow, over to 4 to 5 minutes. Okay, the 4 or 5 minutes have passed. How are you doing, Debbie? She says good. So Debbie, we're going to do one more flush. Make sure the medication is good, gets into you. First 30 seconds you want to infuse at the same rate that you gave the medication at. And then after that I will pulsate the rest of the 10 milliliters into the central line. So the first 30 seconds, time it. Once your 30 seconds are up, then you will need to pulsate for a central PIC line. The rest of the 10 milliliters into the catheter, the central line catheter lumen. Once you have pulsated this medication in, you want to clamp the lumen. Ask the patient how they're doing. Debbie says she's doing okay. Just remember, I'm going to give you the call light. If you need help getting up, remember to call us. We don't want you to fall. Give her the call light, lower the bed. I'm going to go document my name, date, time, the amount of the medication, which was 1.3 milliliters of morphine sulfate for the patient. The patient tolerated the procedure well. And that is it. I'm going to go and take off my gloves wash my hands, and then I would throw away my supplies before I leave the room. Thank you.